Gangdeep Kang is the director of the Translational Health Science and Technology Institute in the National Capital Region, and she is visiting us on the occasion of the 66th annual day of CSIR-CDRI. We've taken the opportunity to speak informally with her for her views on things apart from what she addressed during her Mellanby Memorial Oration. Dr. Kang, how does it feel to be a medico transported suddenly into academic realms and given opportunities as well as challenges that have not really been associated with the medical profession as such?
Well, actually, I've moved from a medical school to the Translational Health Science and Technology Institute, and the purpose of moving there was to give it the opportunity to become really translational. This has been a problem in India all along, where we have outstanding biologists, outstanding institutions that do research, but the bridging to a clinical application very rarely happens. One of the reasons that I wound up coming to THSTI was because I had been engaged in phase 1 clinical trials of vaccines. I've done trials for both rotavirus and cholera vaccines for multiple products, and what THSTI was looking for was someone who would allow them to do that first in human bridge. So I don't think it's been quite as much of a leap as you think it is.
Okay, but traditionally, doctors used to keep compounders like me to do their compounding and dispensing. The question was more focused in that sense, that did you get impatient with our pace of development, or did you get impatient with the fact that you're simply not competent enough to do the translation of research leads from the biology groups?
In medical institutions like medical colleges and hospitals, the opportunities are actually brought to you. Right? There will be a company, there will be an academic group that will want to work with you because you have access to patients. What THSTI gave me was the opportunity to do something else, which is find the places where the innovations are starting and then think about how we would make a path for them into humans and the clinic. So that's what I'm looking forward to doing there. The other aspect of this is really about the difference between medicine and research in public health, which is what I do. In medicine, what you largely do is treat the individual patient. So there is an almost automatic feedback loop, because your patient gets better, you see the patient better, and that's your reward for the moment. But you can treat only one patient at a time and only so many patients in a day. What working with drugs, diagnostics, vaccines allows you to do is actually to influence many more than one person at a time. If you work on a product that can be delivered, you're actually acting as a multiplier for health. It's not additive.
That is really admirable, and like most institutions or private companies engaged in what is known as translation, what has been your experience of the regulatory landscape in India and abroad? You sat on committees for WHO, and would you say that in India especially, we need a much more pragmatic approach towards regulation?
I think we certainly need a more pragmatic approach to regulation. One of the things that I work on is also research ethics. So when there was the Supreme Court order on clinical trials being stopped, we were a big part of that, and we did a lot of arguing the case for why clinical research needed to continue to be done in India. I know the argument was that Indians were being used as guinea pigs. I take it the other way. Why should we have the benefit of drugs that are not tested in our populations? So there's a reason to continue to do this kind of research in India. But where regulatory processes are concerned, both in India and elsewhere, I think there needs to be a rationalization of why a regulation exists. A lot of this has been done ostensibly for the purpose of harmonization and for the setting of standards. But there are some things where a regulation doesn't necessarily make sense. So, for example, if something is to be delivered orally, what are the standards for that versus the standards for an injectable? And have we thought about clinical testing of both of those? What would be the parameters of safety that you would look for, not just efficacy? So I think regulation does need attention. And one way of thinking about it is, in India particularly, a greater engagement of medical experts in regulation. I know we have subject advisory committees for a number of things, but I think closer relationship between pharmacologists and people who actually manage patients would allow us to develop more sensible pathways.
Having said that, would you say then that India's history of vaccine manufacture in particular, since colonial period maybe, and the subsequent use of incident-free vaccination of millions and millions of children, is sufficient post-marketing surveillance evidence to say that our traditional public sector manufacturers are well placed to continue manufacturing vaccines? And
okay, I'm old enough to have gotten the old TAB vaccine.
It hurt.
It hurt. It was very reactogenic and was a vaccine that was withdrawn. I don't know if it worked or not. I certainly have never got typhoid. But that was a vaccine that was made by public sector manufacturers. Similarly, we had rabies, BCG, a number of vaccine products that were being made by public sector manufacturers for our national immunization programs. And for the time, they were valuable vaccines. They continue to be valuable vaccines. I think if our public sector manufacturers meet a level of manufacture GMP practice that is acceptable to our regulators, I don't see why we shouldn't continue to have them. And I think I'm enough of grounded in the 60s and 70s to think that having in-country capacity to make things, whether it is drugs or vaccines, is a good thing. Whether that comes from private or public sector is another matter. I personally think that having public sector manufacture gives you more control over pricing because you can decide where to set those prices. And that's protection against what the private sector might decide to do.
Thank you very much, ma'am, for your observations. I would like you to end with a message to our young researchers, especially the students, about, even if they are not medical students, most of them, how they should orient themselves to the changing demands of translation versus discovery versus curiosity.
I think you have to follow your passion no matter what it is. There are some people for whom application is really important. They need to see where the work they are doing is going. Other people just want to find things out. And there isn't a problem with that. I think research in biology and every other field needs people who do both. So I would say that again. Find what you love to do and then go out and do it.
Thank you so much.